Joining me to discuss is Dr. Aslam Dasoo, who is the convener of the Progressive Health Forum. Doctor, thank you for being with us. We chatted to you early in the week about dire conditions at Charlotte Maxeke and the fallout because of the fire there and the reconstruction that has not taken place. What about Baragwanath? Did you support today's protest?
Good evening, Francis. Most certainly we did. It's actually a very important thing that happened today. In that professional staff have, I think really for the first time in the democratic era, decided to make their voices heard. And this is remarkable because generally they are not just personally constrained, but they are also constrained by their employer and victimized if they were to speak out on any negative issues in the system. And I think they've reached a point where this is no longer going to be tolerated. And so these clinicians have come out, from professors to doctors to nurses to a range of health professionals. And I think this is the beginning of a much larger wave of protest, especially here in Gauteng, where there is such a difficult situation in the public health system. And we know that this, the system is all interconnected, and if something happens at one major institution, there is fallout on all of the rest.
Yeah. Let's look at the food issue, because the Department of Health says it was just bread. There was a shortage of bread. We've heard differently. What have you heard from staff members?
Yes, we've also heard differently. And, this is not the first time this has happened. The Department of Health has serial culpability in under-provisioning facilities. And the problem with that is that the patients get hit first. In this situation, it was so dire that staff, professional staff and medical staff had to dig into their own pockets and bring food in for their patients. I mean, we all have great ethical responsibilities as medical personnel, but I don't think it extends to having to feed the patients in a facility in the middle of the most industrialized city on this continent and run by a department that gets billions and billions of rand in its budget, but can't do something as elementary as fixing the food situation in one of its major facilities. It beggars belief.
Is that issue resolved? The department is saying it is. Do you know?
Yes, we've seen a letter from the department indicating so. Clinicians are waiting, because it's not just bread, there's other food stuff, milk and so on, and waiting to see if this actually kicks in tomorrow morning. I think we'll know by then if this has actually been resolved. But many are, so jaded, they're not holding their breath that this matter is done.
And you heard stories about corn on the cob being given. So this was nurses and doctors, and they've raised the issue. You can't give medication in some cases to somebody who hasn't eaten, basically.
Of course. And I think this is, like I said, elementary aspect of hospital care. It's amazing that we're even discussing this. It's truly astonishing that we have reached this point. And over the last 15 to 20 years, there has been a gradual degradation of the most complex and comprehensive public health system on this continent. And this is important to note, especially for the residents of Gauteng, that their key facilities are all now so challenged, and that the closure of Charlotte Maxeke after the fire a year ago has impacted so heavily on the other components of the system that there is now permanent damage that will take time, years perhaps, to recover from. Right now, what's happening, for example, at Helen Joseph and I believe at Barra, where the incidence of overloaded patients in the emergency departments, psychiatric services not being available, etc., has created an almost medieval scenario here. And if I may just say that, look, these elements, all combine to demonstrate, first of all, a dereliction of the duty of care by the government. And second, when you hear these clinicians speak out like this, after years and years of being kept under the thumb and threatened with victimization, you get an understanding that there's an element of an abuse of office. And these two things combine to give you criminal negligence. For example, in what we're seeing with the fact that patients can't get the care they need, and there's death all over the place.
Dr. Dasoo, we have 30 seconds, so very quickly, is this surprising? Because there was such a focus on hospitals during COVID-19. Remember, the lockdown rationale was to get hospitals ready for COVID-19, but there was also a focus on a hospital in the Eastern Cape where rats were found by foreign journalists. So things we thought would get better, but it sounds like in some instances they've gotten worse.
Well, here's the thing. These same clinicians who are protesting were our last line of defense. They went beyond the call of duty during this pandemic. And I think that perhaps masked the deficiencies in the system during COVID, when everyone was just focused on getting us through there. But, COVID reveals, and it has revealed this desperate situation, not just here, but in other provinces as well. And I think the only way out of this is for the national minister and the presidency to prevail on national treasury to put this department under administration. Putting the provincial department of finance or treasury here, getting them to put it under administration won't work. These are all people who work with each other. We need an overarching intervention to put in a new team, an entirely new team to fix the system, to at least stabilize it.
All right, I have to leave it there, but thank you very much, and we'll keep in touch with you as we follow conditions at hospitals across Gauteng and across the country. That was the Progressive Health Forum's Dr. Aslam Dasoo.